The floor is yours. Thank you.
Thank you very much, Agnesa. Thank you very much for the invitation to participate in these 2 days about the progress and this conference about global health. And as you know, antimicrobial resistance is also a global health concern. Yes, indeed, as you can see on this slide. First of all, we have to remind that before talking about antimicrobial resistance, antibiotics save millions of lives every year. And that in some countries, people die of infectious disease, not because about antimicrobial resistance, but because they do not have access to antibiotics. However, due to multiple factors, including an overuse and misuse of antibiotics, but not only, we have now antimicrobial resistance. And you have on this figure, you have here the mortality rate due to antibiotic resistance. And you can see that, unfortunately, and the countries with the lowest income have the highest burden of resistance. And in this last paper, there are forecasts from now to 2050. And you can see you have, on the upper side, you have the situation in 2021 and the forecast to 2050. And you can see that there is an increase in the mortality rate in 2050. And from now to 2050, it is the modeling study says that we will have 30 million people dead because of antimicrobial resistance, and globally almost 2 million per year in 2050 if we do not do anything. And I told you that one of the reasons is the misuse and overuse of antibiotics, but another main reason is also the lack of sanitation infrastructure and access to safe water. And it is known that AMR is closely linked to poverty, lack of sanitation, lack of hygiene, and also pollution. And in the 2023 report from the Environment Program of the United Nations, they say that AMR also exacerbates inequities within societies, and more particularly women, children, migrants, refugees, people employed in certain sectors as agriculture or healthcare system, and those living in poverty. And these people will be particularly vulnerable to drug infection resistance. And climate change, loss of biodiversity and pollution also increase antimicrobial resistance due to, for example, excess of flooding, and you have the runoff of the soils going into the river, and then you have an increase of bacteria and resistant bacteria and resistant genes, but also due to migration, due to climate change. And so we have a concentration of people in urban areas in which the infrastructure is not sufficient to absorb all these habitants, with a runoff also of the treatment plant when there are treatment plants, because in the world, 60% of domestic or industrial wastewaters are not treated, and they go directly into the river. So antimicrobial resistance is really a One Health network. The bacteria do not know borders, no geographical borders, and neither ecosystem borders. And we have also, when we have to deal with antimicrobial resistance, we have to also connect with all the value chains. Agriculture, food chain, healthcare organization, wastewater management, sanitation infrastructure, production, sale of antimicrobial and vaccines. So So we need absolutely to tackle AMR to have a One Health approach, but also a coordinated global health approach. And we try in the EU-JAMRAI too. So this joint action, we have had this first joint action on AMR and healthcare-associated infections from 26 to 2021. And now we are coordinating the second EU-JAMRAI. We started last year until 2027. So there is a connection between the EU Global Health Strategy and the EU-JAMRAI too. In the EU Global Health Strategy, AMR is one of the most urgent cross-border health threats. And we need for that a comprehensive One Health approach and the EU leadership in international AMR governance. And in EU-JAMRAI, we want to go from strategic vision and political declaration to concrete actions on the ground. So about the One Health approach, all of our actions are One Health across 30 countries. And about the EU leadership, we are working as a mechanisms for strategic leadership by building EU-wide knowledge base, facilitating policy convergence through a work package dedicated to member state engagement. We strengthens Europe's contribution to international AMR fora. We also want to empowering countries to implement the EU global health strategies and speaking with a unified global voice. So where we are now and what is exactly EU-JAMRAI 2? So it's a project with 62.5 million euros, 50 coming from the Commission with 30 countries, so all the 27 EU member states plus Iceland, Norway, and Ukraine. We have 128 partners, and it's a 4-year program. So the key words of our joint action is capacity strengthening through network sharing best practices, preparedness through surveillance, antimicrobial stewardship, prevention, infection control and prevention, access. We support national activities through member state engagement and implementation of action in the National Action Plan. We also have work dedicated to awareness, education, and training on AMR, and not only the healthcare professionals, but also the citizens, and everything is done with a One Health approach. So where are we now? Some first results about the member state engagement. We want all the member states committed in the fight against AMR and implement concrete action. So for that, we to increase the collaboration between the member states and to force them to share their best practices, we have created a policy group, a network of policy officers, one in each country, to identify country-specific needs and also to ensure that the uptake of the EU-JAMRAI 2 findings in the National Action Plan. So we will launch a survey to identify gap, best practices, and priority. We also have made, and we still doing interviews to better understand the country's priorities, and we are developing a support program to help the member state to move forward the implementation of their priority-based actions. We also want to train what we call One Health professionals. One Health professionals in antibiotic stewardship and in infection prevention and control. And for that, we will define core competencies and core components, starting from evidence, working with relevant stakeholders and working collectively through meeting, workshops, and have also a sector-based approach because antibiotic stewardship is not the same in primary care, in long-term care facilities, or in hospitals. About surveillance, it's very important to survey antimicrobial resistance at the European level, but also with a One Health approach. And for the moment, the surveillance is done mainly in silos or does not exist in some areas. So we have generated evidence on existing national and European surveillance program in human, animal, and environmental health. And we develop what we call the EARS-VET network. Maybe you know the EARS-NET program from ECDC. EARS-NET surveys antimicrobial resistance in human health, and EARS-VET surveys antimicrobial resistance in diseased animals, not only livestock, but also companion animals. And that does not exist for the moment in EU. So we have started the EARS-VET in the first joint action, and we extended it now. And we have created in the EU-JAMRAI 2 also the EARS-ONF program to develop surveillance in the environment. And it is also needed because there is recently a EU directive saying that all the cities with more than 100,000 inhabitants must survey their wastewater for AMR. So we are working to define indicators and the techniques to survey. And we are working with another joint action, the EU-WISH joint action about wastewater surveillance globally of global health, and the network EU-NET. So we really want to have an integrated One Health surveillance. And about improve access to antibiotics and AMR-related products in Europe, we have identified human and veterinary products with vulnerable supply in each participating country. So you can go on our website and you will see for all the countries participating in this task about access, what is their priority list. And now we have identified also for each of these countries the barriers and the barriers to access. And now we are doing tailor-made interventions at national, regional, or European level to secure access to these products. And last but not least, we want to improve citizen commitment through awareness raising. And I wear today this symbol we have created during the first joint action. This symbol is the AMR symbol promotion. And I'm sorry because I forgot to bring some today to give you. And but you can do it by yourself. It's very easy. You draw two hearts, one red, one white, and you cross them. And you have the AMR symbol. And we have now delivered 8,000 pins in 20 events, including the UNGA I11 meeting last year. We have also campaigned in social media. And the last one, you can have a look, is the AMR Art Memes campaign. And we have established a network of communicators at EU level. And we are in progress about defining key messages and materials, and also have actions in schools. So working, you say that you all said that yesterday and also this morning, that the key to success is working in synergy and not in silos. And it is difficult. We all know that. So the EU-JAMRAI to provide the co-funded collaborative platform to support EU and associated countries in achieving EU global health strategies by reinforcing One Health, improving surveillance and early warning, promoting responsible use of antimicrobials, and raising awareness and building capacity. And for that, obviously, we do not work alone. We have many stakeholders. We have a stakeholder forum of more than 40 stakeholders. And we also work with the different DGs, and first DG Santé and DG ERA, but also agencies at the European level, international organizations, obviously the quadripartite, and other joint actions. So the EU-WISH joint action about the wastewater, CHESMEN, which is a joint action on medicine shortages, and obviously the GAGHI. why we work in synergy with all this action. Because if we want to be successful, if we want to change the world and modify and having an impact on global health, we have the power of being one. And I will just end my talk by this short video we have made summarizing the action of the joint action.
This is a story about EU-JAMRAI 2 and the power of being one. A story that begins in Europe, where 120 partners from 30 different countries discovered that they shared a common challenge: reduce antimicrobial resistance. A big challenge, true, but they also discovered that by joining forces, connecting, sharing knowledge and building a One Health community on AMR, they are much stronger. They can create a great shield. And not only that, acting as one, they are bigger, more visible and reach further and more people. Together, they are building a One Health world to reduce antimicrobial resistance because they understand all areas of health as a single challenge. They are one, sharing strategies, promoting rational use and ensuring access to treatments. One, preventing, monitoring and providing sustainable global responses. One, with a symbol that unites not only them, but the whole world. We are EU-JAMRAI 2, and we are ready to embrace the power of being one to reduce antimicrobial resistance.
If you go on the website, you have also a 5-minute video, and we have also participated last month to the Warsaw General Assembly, and we presented specific videos dedicated to animal health. And everything is really with a One Health approach, and even for antibiotic stewardship and infection prevention and control. We do that in the human health sector, but we do also antibiotic stewardship action and infection prevention and control actions in the human sectors, and also the impact of prescription of antibiotic impact into the environment and how to have a more responsible use of antibiotics. Thank you very much.